This year's theme, Mental Health in Humanitarian Emergencies, resonated deeply with students, educators, and policymakers gathered for the occasion. Facilitators emphasize that mental illness should not be misattributed to evil spirits, causes, or supernatural forces. Instead, they urge students to recognize mental health conditions as legitimate medical issues, distinct from physical ailments, yet equally deserving care and compassion. Ogis Jata, representing the Life Skills Education Unit at the Ministry of Basic and Secondary Education, called for mental well-being to be prioritized within schools. Celebrating mental health, he said, is just as vital as celebrating education itself.
The day of celebrating mental health is as significant as also being in the classroom. If you understand, education itself is about the psyche. If the psychology of the person is not in its right frame, the tendency of the person learning will be very, very slim. And that is why it is normal, like as alluded to by Lenisa, that we have stress, we have anxiety, we have depression. It happens. And some of these things, we don't consider them as mental health. They are. And it's important that we factor it. The expert will take you through the nitty-gritty of why it is important that we all take care of our mental health. The Ministry of Basic and Secondary Education is very pertinent in terms of issues of health.
Honorable Mod Lamin Biba, National Assembly Member for Banjul North, President of the Global Youth Mental Health Forum, and Vice Chairperson of the Health Select Committee, delivered a keynote address. He reaffirmed Parliament's commitment to reshaping responsive medical health policies. Ba also commended the Ministry of Health for deploying mental health professionals in all public health hospitals nationwide.
Especially establishing a mental health program unit within the ministry, and also making sure that all the major hospitals in the country have experts that deal with issues surrounding mental health, which is also another improvement. But yet still, in our role as members of parliament, we want to see things going further, and that is to make sure that there is an updated mental health law in the Gambia.
Lenisa Mendy, a psychiatric nurse with the National Mental Health Program, highlighted the importance of supporting individuals with mental health conditions, especially during emergencies. Her remarks echoed the day's theme and underscored the need for inclusive care systems.
This theme reminds us that during times of crisis, such as floods, disease outbreaks, or displacement, mental health is just as important as physical health. Many people, including students like you, face stress, anxiety, or fear during such times. It is okay to feel overwhelmed. What matters most is to know that you are not alone and support is available.
Amadou D. Jallo, a mental health nurse at the Kanifing General Hospital, tackled community misconceptions. In his presentation, he challenged the belief that mental illness stems from spiritual causes and advocated for a scientific, empathetic approach to diagnosis and treatment. The event also featured student-led dramatic performances, portraying the life experiences of those with mental health conditions. These powerful vignettes promoted empathy, understanding, and solidarity. According to the World Health Organization, mental health is a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, work productively, and contribute to the community. Lamin Ba, Star TV News.